Hi, my name's Phil. I like talking about politics, and in this video I'd like to catch up on what experts are saying about our government's COVID insanity from both within the UK and around the globe, and also how Boris Johnson and Sajid Javid's response is to continue to deny reality, but all this is going to do is help the infection spread even further. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So the COVID app in Britain, it's going crazy. Of course it is. We've been easing back on social distancing messaging at just the time when the Johnson variant has been sweeping unchecked throughout our merry little plague island. The obvious consequence of that is that a lot of people are now testing positive for the infection. As a consequence of that, a lot of people have been told by the app to isolate because they've been in close contact with an infected person for long enough. And it's a lot of people. The government were warned about this. Keir Starmer raised the issue with the Prime Minister earlier this week. He asked him what he was going to do about it. For those who didn't watch my PMQs video this week or hadn't watched PMQs itself, Johnson said he didn't understand what Starmer was asking. I don't understand what's going on. I don't know what's happening. Well, I hope he does now. A political correspondent for Sky reported that the civil service was concerned about the sheer number of people expected to have to isolate over the coming days. That it could become a huge problem over the next few weeks. Does the Prime Minister understand the question now, I wonder? It seems not, because the reports are suggesting that the solution... See, there was one solution thinking, well, what we need to do is get these people tested really quickly so that if they're fine, they're clear, they don't need to be quarantined anymore. That worked out really well. And the government are going, no, we're not really sure we fancy that. They haven't said why. I strongly suspect cost and the fact that Dido Harding is still largely in charge of testing. So now they're suggesting that the solution to be applied is just make the app less sensitive. Well, if we make it less picky, then there won't be as many people isolating. Problem solved. For the love of puppies. This is what happens when you put people in charge that don't understand things. The problem is not the sheer number of people being pinged by the app. It's the sheer number of people becoming infected. Remember, the reason for asking these people to isolate is to reduce the spread of infections. That's the problem we've got. And if you make the app less sensitive, you drive up infections even more. And it's already a fairly steep rate of growth. It's really this simple. Right now, we've got a 7-day moving average of about 28,000 new positive results per day. Extra. The actual number of new infections per day will, of course, be much higher, as not all infected people show symptoms and get tested. In fact, most don't. Make the app less sensitive and you make that curve steeper, so the growth in new infections, which is already about 50%, will gather pace, rather than be slowed down and reversed, which is what we need. Then in 10 days, we're going to be changing the rules again. I say changing the rules, I mean throwing them out, so that there'll be even less social distancing and less use of face masks. That will drive infections up more again. And I cannot say this enough because my brain is screaming out. This is summer. This is happening when the weather is generally warm and people are more likely to be meeting up outdoors where the risk is way, way lower. It's summer, and experts are telling us that we're headed for 100,000 new cases per day. None of them are saying, thank goodness it's summer. They're all saying, you're insane. You know that, don't you? Oh, but the vaccines make it different this time. Do they? This is a chart of cases against people on ventilators. The correlation is clear. Sure, the proportion of infected people becoming seriously ill is way lower, but the link is still there. If you double the number of cases, you double the number of hospitalizations. The link has not been broken. Some hospitals are already being overwhelmed. Some hospitals have already started cancelling other treatments again, including for cancer. The bellends who keep arguing that lockdown is bad because people are dying of lack of hospital care for other things. It's not lockdown that deprives those of people of hospital treatments. It's the hospitals being full of COVID patients. There's no rules in the lockdown that says hospitals have to stop giving treatments for other things. The reason they have to cancel them, they've got no beds. They've got no doctors or nurses. I cannot tell you how maddening it is to be trapped on an island of sheeple who haven't learned a thing. Frankly, the public let the government off lightly last year by excusing their errors on the basis of, well, it's all new. Bollocks, was it new? We've got experts whose specialised field of study is viral pandemics. We had new terms brought to the public debate last year. Epidemiologists, virologists. Knew my arse. But at this point, there's no excuse at all. We're doing the same wrong things in the same wrong way, getting the same results, and still not learning lessons. An Irish public health specialist for the World Health Organization, Dr. Mike Ryan, described the concept that the more infected people you have, the better, as moral emptiness and epidemiological stupidity. Medical and scientific experts in the UK are urging the government to rethink like I've never seen before. We've always known that the government are making the wrong decisions. They have always urged the government to rethink. At the moment, I am seeing acts of extreme urgency and desperation from these organisations. They are desperate. They know what's coming. The government's policy has been described as an experiment. It's only an experiment in the same way that someone might experiment by pouring petrol all over their shed and then throwing a lit mat onto it. There's no doubt about the result. The government's hypothesis seems to be that hospitalisations will not get to unmanageable levels. That's what they're saying. We think, yes, we know that hospitalisations will increase, but we think they will manage, they will cope. They don't seem to be at all put off by the fact that there are already hospitals experiencing unmanageable levels in some areas. And that we are expecting it to be 4 times as bad later this summer. And when I say 4 times as bad, I just mean in terms of infection rate. The only element of speculation, the only actual experiment, is whether or not we're going to get a more vaccine-resistant strain. And that's not a matter of pure chance. We are told very clearly by the experts that for those who don't understand how viruses work anyway, that if you have a population that is partially vaccinated and you let infections run riot, you actually create the perfect conditions for vaccine-resistant strains to emerge. That's the only experiment that's going on here. And if it happens, never mind blaming China for suppressing information on the original outbreak, we will be the country who has deliberately cultivated the nastiest possible form of the disease. The world's experts are looking on in horror right now. Consider that we were actually in a position to end the final stage of the roadmap last month. According to the original timetable, it was all fine. It was all set fair. Grand. We were actually in that position. Then the Johnson variant was allowed into the country. And I mean allowed. It's not that we didn't know enough about it. It wasn't that the government weren't warned about it. They made a conscious decision to allow it in. We knew we were letting it in. Now we're headed for a third wave that will beat even the devastating second one we had this winter. And if we create an even worse variant and that gets into other populations, we'll be triggering another level of this disaster globally. I mean, I'll be honest, I have no idea why any country in the world right now is even allowing people to travel to them from Britain. Like, if I were the head of a government elsewhere, I would be asking daily about the risks of doing this and getting ready to shut the door as soon as it's considered too high. Talk at the moment is of the Lambda variant from South America. Obviously, nothing is known about it yet. It's just one of those where, well, it might be, we don't know. A reminder that it takes time to discover if a new variant is going to be the next major concern. And once you do discover it, the way you discover it is because you've suddenly got a load of data. Well, how do you get a load of data? It has to run riot somewhere in the world. So basically, by the time you realise it's of concern, it's already buggered up at least what the country of origin. So if we do cultivate a new, especially resistant variant, it could be pretty widespread here before we realise just how dangerous it is. We are actually screwed this summer. Yes, just because we're creating the conditions for a new variant doesn't mean we will create one. It's a little bit like a lottery. You know, we're doing the equivalent of buying a lot of tickets for a prize nobody wants, but it's not certain our numbers will come up. But we are making it much more likely. We have a problem that has senior officials in the civil service The Chancellor, the Cabinet Secretary and the new Health Secretary all involved in discussing that on Wednesday our Prime Minister claimed not to understand. We have international and domestic condemnation for what we are doing and how we are going about it. There is no angle at which you can look at this that doesn't result in a conclusion of being completely and utterly screwed. And then whenever I think about this, and I think about it every day at some point, there's that part of my brain, an absolute arsehole part of my brain that chips in with, you think it's going to be bad this summer? You wait till autumn, mate. But those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.